So we're concerned that patients aren't always getting the best level of care that they can. So examples that we saw where patients needed urgent medical review, so by a doctor, that didn't happen in a timely fashion. The doctors didn't always respond promptly to pages from nursing staff asking for assistance. So there were delays in patients receiving timely care, and on occasions the impact of nursing staff having to contact the critical care unit or the intensive care unit to access medical staff from there to support deteriorating patients. I'm also concerned around out of hours and weekend cover and patients not getting the best level of care because the medical reviews and the specialty services just aren't available at the times that patients always need them.
When you spoke to staff there, what were they telling you?
So staff were telling us that they were particularly frustrated around not knowing who the designated doctor for a patient was, for example, and not getting prompt support and advice when they needed it. So there was some frustration amongst the staff, although we need to recognise that the tremendous efforts that the staff have been making, particularly around the compassionate care that they're still giving to patients, and maintaining their outstanding rating for caring, again, needs to be recognised and celebrated.
In terms of the situation they find themselves in, is it a simple one to try to rectify? Is this potentially quite a long-term problem, and it may take a long time to certainly move back up to the standard that you would like to see?
So I think there are some things the Trust can do, some things that are within their gift. They have had some success, for example, with recruitment internationally. So there are things that they can do, but they're also working really closely with another hospital trust to provide some additional support. So I'm not going to pretend that these are issues that are going to get fixed overnight, but the Trust have already produced an action plan and are working to resolve these issues. So we do expect to see progress being made. The time scale for which we don't know, but obviously it needs to be done as quickly as it possibly can.
What do you hope the impact of this inspection will be?
So the actions really that we want to see that the Trust take are to improve the staffing, particularly around having adequate staff to respond to changing patients' needs, and to tackle some of those challenges around 7-day services and out of hours cover. So really, what we would hope is that the Trust takes the report and puts together a strong action plan, which, as I said, they have already started to do, and start turning the dial. So the report that we have provided gives them the tools, I suppose, to recognise where the improvements are needed and focus their attention on those.